Hi, welcome back to another episode of the Rotator Cuff Expert. I'm Dr. Daniel Orcutt. I'm an orthopedic surgeon, and today we're going to talk about positions after your surgery. We typically just talk about rotator cuff repairs, but there's other surgery on the shoulder, whether it's a total shoulder or slap repair of the labrum, or something else that has a similar recovery time, similar recovery symptoms and protection. And so today I'll talk generally, but it probably applies to most things. Now, the first most obvious thing is if you have shoulder surgery, what should you do? What position should you be in? Well, kind of two obvious points. One is you ask your doctor, what do you think, doc? What position should I be in? And they'll be able to tell you probably before surgery, but sometimes not, but certainly after surgery. So that's the number one thing. So always remember the easiest thing to do is ask your doctor or another physician extender that works with the doctor. Ask them what position will be the best for you to be in after surgery. So typically, the answer is whatever is most comfortable for you. Now, there may be some extreme situations where we don't want you to be in a certain position, but most of the time that position is not where you want to be anyway. It's uncomfortable, it hurts, all those kind of things. So you're not gonna get in that position anyway. But the most consistent position that people want to be in after shoulder surgery, rotator cuff or otherwise, will be in a reclined position. This would be most comfortable for you when you're awake, as well as most comfortable when you're trying to sleep. So a reclined position, you can get in a reclined position in many ways. The reason why reclined position helps is because it supports your shoulder, it supports your arm, I should say. So you will have some sort of support, whether it's a sling or a immobilizer, that's gonna support your shoulder some. But if you lie all the way back in bed, the gravity is gonna pull your shoulder back. And if gravity pulls your shoulder back, that's gonna be uncomfortable. It's gonna be hard to sleep. And if you roll on your side, gravity's gonna pull you this way, and that's gonna be uncomfortable. And in most time, you can't sleep on that shoulder because that's the surgery shoulder, and that's gonna hurt just to do that too. So reclined is the best position. The next question is, so how do I get into the reclined position? One of the easiest ways is a recliner. If you have a recliner, it may or may not be difficult to get in and out of the recliner, so you probably are going to need some help from somebody to be able to get in and out of the recliner, at least early on. The recliner typically is the easiest, but I would not recommend going out and buying a recliner if you don't have a recliner already. I think that's probably a little bit too much cost for the benefit of it. So recliner, so you can be reclined in a recliner. You can be reclined in bed. There are wedges. Wedges that look like pillows that you can lay on. And some wedges have actually headrests that go onto the wedges. And so wedges can be comfortable. And in the next few episodes, we're gonna do some samples of wedges, which ones seem to work better than the others, but that'll be coming up. So look for that episode. 1 is the recliner, 2 is the wedge, 3 is pillows. Obviously, you can use pillows to kind of bolster yourself up, and that's fine too. That's a little bit harder to get the pillows in the right spots, but that's certainly possible. And the last thing is I was researching for this video, I was looking over different wedges, and something came up. And just so you know, I don't know anything about this manufacturer. I'm not getting any compensation for recommending this, but this one thing looked very interesting. It's called the slumber curve. And so you can look it up, obviously just Google the slumber curve. It looks almost like a beach chair, except you put it in your bed. And it looks like it would work pretty well for rotator cuffs as well as multiple other surgeries. But check it out. Again, I don't know anything about it other than it looked interesting. And so I want to bring that information to you. The last question about reclining and what's comfortable is, will I be in an immobilizer, right? Something that kind of holds you with a little wedge, or a little pillow underneath it, or will I be in a sling? And so we don't know. Some of it depends on exactly what we do in surgery, so we might not know before or after. So if you are in just a regular sling, that probably means we didn't repair, which means we didn't suture things back together, and that means you have more leeway. So a sling is easier for you because you don't have the big bulky stuff around, but it also gives an indication that you had a less invasive surgery, a surgery that you will not have to protect quite as much. And that all depends on what exactly you do. And also, typically I'll have someone in the immobilizer for a little while after surgery, especially if they get a block, and we talked about blocks in another video, so look at the other videos if you want to know about blocks. if you have a block, your arm will be numb for the first 18 to 24 hours. So certainly you're gonna need something to help support that arm while you have the block. And that immobilizer is what I would use, or even a sling, again, depending on the surgery, but that's important for the first few days. The question is, well, how long will I have to sleep reclined, right? And how long will I have to sleep with my brace or my immobilizer on? Again, first thing, ask your doctor, that's the most important thing. But general rules of thumb, if you typically you're going to want to sleep in a reclined position for about 6 weeks afterwards. It takes that long for things to recover enough so you may be comfortable sleeping on your side or on your back. Obviously, depending on what exactly is done will determine how long it takes, and some of it's your pain tolerance and some of it's your doctor's input. But we will, if you're in the immobilizer, there are some general rules of thumb. If you are in an immobilizer, you'll be in a immobilizer longer if you have a bigger rotator cuff tear, a thinner rotator cuff, more difficult repair. And so those things come into play. And also what else was done during that surgery. So sometimes we don't just do a rotator cuff, actually almost never just do a rotator cuff. We do a few other things in there. So if we worked on your biceps, your labrum, or other stuff, we'll determine how long you should be in a brace, how long you should be in an immobilizer or a sling. And so again, to talk about that with your doctor. So the short answer is, where should I sleep? How should I sleep? Well, you should sleep in something that's comfortable. So most likely that's going to be in a reclined position for a few weeks. So get your head wrapped around that. That'll help. Make sure you're taking pain medicine before you go to bed so you can sleep, because sleep is super important in your ability to recover. So hopefully this helps. Again, leave any messages, comments, thoughts underneath, and we'll see you next time. Thanks. Have a good night.